sir. Okay, thank you so much. So today we'll be discussing for the jumper's knee, although it's a bit simple topic. So, but still, it require more clarification, like how we progress with the NIBS treatment for treating the case of patellar tendonitis. Although it's an easier one, but still there are few things that we need to include in our treatment protocol. So that is why we thought of discussing this too. And this is also very common nowadays, patellar tendonitis, because of the continuous sitting or improper posture, and because of improper training like jumping and all the things. So this causes the inflammation around the tendon of the patella. So basically, it's a quadriceps tendon that is inserted into the tibial tuberosity. So that tendon got inflamed, and there are possible reasons why this occurs. So that we will see, and also we'll see about the treatment part, how we can treat using the NIBS and Shaftesbury's method for the treatment of patellar tendonitis. Yeah, translation please.
Jadi hari ini kita akan membahas tentang patellar tendonitis atau inflamasi yang terjadi pada daerah patella atau sering disebut juga dengan jumper's knee. Walaupun topik
so which comes just near to the patella and has all the quadriceps muscles. So these are coming, and all these quadriceps muscles, the rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. So all these four muscles join together to form the quadriceps muscle, and these quadriceps muscles join together to form a single tendon. So that means all these muscles which are coming from above, and they are inserted at the common tendon, that is the patellar tendon. And this patellar tendon is inserted into the tibial tuberosity. So it has a common space for all the muscles of the quadriceps, and so since it's a tendon of the quadriceps muscle, so it's a very strong tendon, and it plays a major role in the stability and the different structures that are there around the knee. So it's a very strong tendon, and it is around the patella. So all these muscles join together to meet this area. Yeah, translation please.
Jadi quadriceps ini terdiri dari berbagai macam otot, misalnya rectus femoris, vastus intermedius, vastus medialis, dan vastus lateralis. Nah, ini membentuk satu tendon pada quadriceps yang kemudian akan membentuk satu single tendon, yaitu patellar tendon. Nah, tendon ini sangat kuat yang berperan dalam menjaga kestabilan pada daerah lutut.
Right, next slide please. So here you can see in this picture, so above is the bone, and the structures which are there are the above there is a thigh bone that is called as the femur, and in the center there is the kneecap that is called as the patella, and just from patella to the tibial tuberosity. So this is the patellar tendon which you are seeing. So from patella to the tibial tuberosity, it is the patellar tendon, and it comes on the shin bone. So whenever there is any swelling or whenever there is any specific force around the knee joint, so that will create a specific force around the friction around the patellar tendon. So whenever there is more friction around the patellar tendon, this will create a certain swelling inside the patellar tendon. So this swelling causes the inflammation, and with the swelling there would be the pain. So whenever such patient comes to us, they will tell about the pain exactly at the site of the patellar tendon. So the pain and swelling would be present around the patellar tendon. So the reason for the pain and swelling is because of the inflammation. Why does this inflammation occur? It is because of the friction around the patellar ligament. So whenever this patellar ligament goes into more of friction, so why this friction occur? It is because the nearby muscles, certain muscles becomes tight and certain muscles become weak. Due to the imbalance of the muscles around the knee, it will create more pressure around the patellar region, so which lead to the swelling of the patellar tendon. Okay? Due to the imbalance of the muscles around the knee, this will create a specific pressure around the knee area, patellar area, and that will cause the pain. Yeah.
Jadi misalnya kalau ada beban atau sedikit apa namanya apa ya ada bagian
Patellar tendinitis, the patellar tendon and the tissue surrounding the tendon. So that goes into inflammation, right? So inflammation is just a sign in which there are few signs like swelling. Okay, so there would be swelling, pain, and tenderness around that area. So that causes the inflammatory sign. The inflammation in short term, you can see in the common term, we say that it is just a swelling inside that particular structure, right? This swelling will cause the pain and tenderness and redness around that area. So whenever this tissue get affected, so it causes certain swelling. And why this occur? It is usually because of overuse. Overuse, like in the jumping activities. So that is why it is more commonly known as the jumper's knee. It is because of the jumping activity, but not necessarily. But nowadays we also seeing that those who have the sedentary lifestyle, like they get into the muscular imbalance because of some postural problem, and then they gradually develop these things, even though they do not have any jumping activity or like that, but because of certain postural problems, this also occurs. Yeah, translation, please. Right, next slide. So here are the possible causes. These all are related mostly with the sports activities, but as we discussed here, these could also be possible those who have a sedentary lifestyle or using improper footwears. So here are the few possible causes that are related usually with the sports, since it is known as the jumper's knee. So in the physical activity which requires jumping, like basketball, volleyball, biking, running, so all these activities causes the patellar tendinitis. Whereas other activities which requires long distance running, they have to run for several uh, meters or kilometers, like marathon runners, long distance running. So intense running, that will also further lead to the tendinitis. And other things, like it is when in certain activities, like in sports, when they have to frequent start and frequent stop. So that includes the tennis, high impact aerobics, soccer, So squatting, even the squatting like ball catchers, so they are, and kneeling, and those occupations which require kneeling, continuous kneeling for long hours, like carpenter. So these are the possible causes which occur and does inflame the patellar tendon and causes the patellar tendonitis. Yeah, translation please. So there are few other things that, yeah, Q angle. So Q angle is also very important when we see the impact of the Q angle on the patellar tendon. So as we discussed yesterday, but still we want to clarify this furthermore about the Q angle. So Vinny, can you go to Google and write the Q angle again? Yeah, this is the Q angle which you can see about the Q angle. So there is a specific range regarding the Q angle. So normally the Q angle is at 15 degrees. Normal range is the 15 degrees. So if it is more than that, so then we call it as a knock knee. And if it is less than 10 degrees, then we call it as a bolex. So Q angle is the area that we need to measure. So what we have to do is we have to draw a imaginary line. We have to draw a imaginary line which is from ASIS to the center of patella. From ASIS to center of patella, we'll draw one line, and the other line is just from the tibial tubercle to straight. From tibial tubercle to straight. That means towards the center of the patella and above. So this line which we draw is called as the angle the angle which forms between these two lines, that is between the ASAS and center of patella, and from the tibial tubercle to the straight line to the mid thigh. The angle which form in between these two is called as the Q angle, and this Q angle is responsible for various you can say biomechanical force which is coming from above onto the knee. Biomechanical forces which are coming from above to the knee. So that is mainly the factor which decides about the direction of force which is coming into the knee. So if the Q angle is variable, that means if it is more or if it is less, then it will create direct impact on the knee. It will create direct impact on the knee, and due to the disturbance of the biomechanical force, this will cause the pain around the knee, and hence the patellar tendinitis is also one of the reason for this. Yeah, translation please. Or towards the outer side, this will create you can say the biomechanical force which are coming directly onto the quadriceps muscle, they will deviate, and once this thing is deviated, so it will create you can unnecessary pressure which the biomechanics, once it is disturbed, it will create certain pressure around the patella. So this pressure will cause the pain around the knee area. These are the internal factor. So external we have discussed, like because of the jumping or certain other activities like sports activities. These are the external factor, and here the Q angle which got disturbed and creates the pain around the patellar tendon. So this is the internal factor for the quadriceps and the patellar tendon. Yeah, translation please. In the extrinsic factor, that is because of the overuse tendon injuries that we have just seen. And there are a few other things like yesterday we were discussing about the IT bend syndrome. In similar way, the footwears and the training errors and the surfaces, so these are also important. So footwears, we have seen that for the sports activities specifically, it requires a good quality footwears. In those, it has a proper arch, and the footwear should be of good companies. If a person play a sports or do any running and jogging activity, because they are maintained and they are designed biomechanically, and even after a lot of research, these companies like Adidas, Nike, so these companies made these footwears after a lot of research. So that is why they are very very comfortable, and person is less prone to injury, less prone to develop any these things like of patellar tendonitis or IT band syndrome. If the person has a good footwear, then there is less likely of chances of developing such things. And apart from this, the training errors definitely that we have seen yesterday, the training errors, if they are not properly trained and they do not have the proper trainer, then also they, because of the improper techniques, like in these sports, like if somebody plays a lawn tennis, so if they start using the wrong techniques, right, okay, due to the wrong techniques also, this causes the inflammation around the patella. So these are because of the training errors. And the surface is also very important on which they practice and on which they play. The surfaces or the ground, like the hard surfaces or the cemented. So in those, it is more likely to be the injuries. Although when the surfaces are uneven, that creates the more force around the knee area, and that disturbs the Q angle. So these are the few things that we need to see. And in the training errors, it is if the training is too much or too far or too fast or too long. So these are the certain factors which affects the area around the knee and thus causes the patellar tendonitis.
Rahul, what about this patellar femoral syndrome?
Patellar femoral syndrome is also one of the same, because in that the extensor mechanism got disturbed. So although our treatment would remain same in that area. Yeah.
Okay. And what this also chondromalacia patella also will mimic, you know?
Yes, because these are also you can say like similar conditions occurring because of similar problems, similar structures, right? So in the treatment part, we'll discuss about all these things, how we can go for with the different conditions.
And even housemaid's knee also.
Yeah, that is basically the bursitis, basically around the
patellar bursitis.
yeah housemaid. Yeah.
Yeah. Okay.
Yes. Yeah, Harman, please translate.
Oke. Jadi faktor eksternal atau faktor luar yang menyebabkan patella tendonitis ini disebabkan penggunaan.
Next slide, please. In the intrinsic factor, definitely the age, flexibility, joint laxity, these are also plays an important role. And apart from this, if the person is overweight, so this overweight what it does, it creates too much tension around the quadriceps muscle, and it will overload the patellar tendon. If the person is overweight, so what it does is it creates too much tension, too much you can say stress around the quadriceps muscle, and this will further overload the patellar tendon. So that is why it creates a soft tissue problem, you can say, and this soft tissue problem will lead to patellar tendonitis. Now, if the person has, you can say, less flexibility of the quadriceps and the hamstring muscle, so then also it will create the stress around the patellar region. Or if there is any, you can misalignment of the leg hips or the feet, so it could be around whole of the leg also, because the muscle imbalance would create from upside down. So it could be created around from the hips and until the ankle. So muscular imbalance could be occur at the level of the hip also, and it could be it could also occur at the feet. So because whenever there is, if the whole of the leg is a kinematics. Kinematic means it is linked with one another. Like feet is linked to the leg is linked to the knee to thigh, thigh to hip. So all the leg has a link. So that is called as the kinematics. So once this kinematics got disturbed, whether if the kinematics of the hip got disturbed or at the ankle, like we say, for example, if there is weakness of the gluteal muscle, if there is weakness of the gluteal muscle, so this will disturb the biomechanics. This will disturb the force which is coming around the knee area. So that will cause the pain. Okay. So this it is because of the misalignment of the leg, hip, or the feet. So that could be that will create the in, overload or increased stress around the patellar tendon, which will lead to patellar tendinitis. So whenever we treat such conditions, we need to see about all these things: the Q angle, flexibility of the muscles, and the strength of the muscles, and not only the knee area but also the hip and the foot area. So all these things we need to check. We need to check the leg thoroughly from down to up. Where is exactly the problem is, and we need to find, and then we need to solve the particular condition. Yeah, translation please.
Jadi
So this is the Q angle, which you can see clearly here. Yeah. Next slide please. The possible symptoms for the knee pain. So it is the pain that is focused around the kneecap, particularly the bottom part of the kneecap. So in the lower portion, yes, below the patellar, around the patellar tendon. So pain would be around the patellar tendon area, right? So it is more focused on the lower portion of the patella. And apart from the pain, there will be some tenderness. So that is all the inflammatory sign is there. So whenever there is some inflammation, remember all these inflammatory signs. These inflammatory signs are pain, tenderness, and swelling. Okay. So these three, whenever there is any inflammation around any region, so these inflammatory signs would always be found. That is the pain, tenderness, and swelling, right? So these three things, tenderness, we called it as when we put pressure on that particular part, so it will aggravate the pain or it will increase the pain, or you can say you will find the pain on that particular area or that particular region. So that is basically the sign of inflammation. Tenderness is the sign of inflammation. And also the swelling. Swelling would be around this particular area, so that will cause the pain. This is the main reason for developing the pain, since uh, the structures which are there around the patellar tendon, so due to the swelling, they will compress the nearby structure, which causes the pain. That is why the patellar tendon pain, the swelling will cause the pain. So all these are the inflammatory signs. So these are the symptoms basically we get when we have a patient of patellar tendinitis. Translation, please.
Jadi simptomnya terdiri dari 3 ya. Pertama ada rasa nyeri, kemudian ketika kita tekan pada daerah sekitar lutut itu ada kayak sakit. Lalu ada tanda-tanda bengkak atau swelling pada daerah sekitar patella tendon. Nah, kemudian nyeri ini biasanya terjadi pada bagian bawah tempurung lutut atau tepatnya di daerah patella tendon. Kemudian adanya inflamasi di sekitar area lutut. Jadi inflamasi ini bisa kita cek ketika kita menekan dia merasa nyeri. Ini merupakan tanda inflamasi. Kemudian juga bengkak di sekitar patella tendon.
Next slide. Now, how we diagnose this particular problem? For diagnosing this patellar tendinitis, so these inflammatory signs we need to see: the tenderness, swelling, redness, and after this has developed, then we will find the atrophy of the vastus medialis obliquus muscle. We'll find the weakness or atrophy of the vastus medialis obliquus muscle, and there would be some restricted movement, restricted motion in the area of the sore tendon. So when we ask them to contract do the isometric movement. Isometric means when the person is sitting in the leg straight position, and then when we ask them to just try to contract your quadriceps muscle, when they contract the quadriceps muscle, it will elicit the pain around the patellar tendon. Okay? So all these inflammatory signs would be there, that is the redness, swelling, tenderness, and muscle weakness would also be present. Muscle weakness is not the sign of inflammation, but it occurs because of inflammation. Because of inflammation, person will not put much pressure on that particular leg. So due to that, gradually the quadriceps muscle, particularly the vastus medialis obliquus muscle, goes into weakness. So once the vastus medialis goes into weakness, there would be limited motion in that particular area. And the other check or other diagnostic things like in that, so then when the examiner press on the different areas around the knee, so that will also causes the pain around that particular area. And there are certain things like ultrasound, and in the ultrasound we can see all these inflammatory signs, the swelling around the patellar tendon. And even if it is if the examiner or the clinician has certain doubts to confirm this, they can go for MRI. Right? Although just clinically we usually test this first by checking the inflammatory signs around the knee area. Translation, please. Next slide. Yeah, next slide, please. Yeah, next one. So in the treatment part, we need to see about the flexibility of the different muscles. Like what all we'll check now when we have seen that there is some specific tenderness around the patellar region, and there is some redness, swelling, pain, all these signs are coming, and patient is complaining of pain exactly around the patellar tendon. So now we confirm that this is the patellar tendinitis. After that, we will see about the flexibility of certain muscles. So for the flexibility of certain muscles, we need to check for the flexibility of hamstring, right? So what if the hamstring is tight, or the quadriceps is weak, right? So Vinny, can you write the tight hamstring in the Google? Tight hamstring muscle. So apart from that, we'll also check for the ankle area. So in the ankle area, we'll check for the flexibility of the ankle. So we'll see the calf muscle, particularly the tendonitis tendon. So when we flex the ankle to when we do the dorsiflexion movement, we can see about the. So here you can see about the tight hamstring. Not this one. Just with the leg straight, tight hamstring. Okay, just write tight hamstring in straight leg raise, SLR, in SLR, SLR. Not here you can see this tight hamstring in SLR, the third picture here. So when usually when we check the hamstring, so it should be slightly it should be straight, right? And but when the hamstring is tight, the knee will get bent. So like in this, you can see the certain angle. Like until it should come under the 90 degrees, although it is not so common. But what happens, like because of the tight hamstring, it will create more pressure on the knee area. Tight hamstring muscle will put more pressure on the knee area. So when we have to check for the hamstring, like when we ask them to just straighten the leg, so just by straightening the leg, Vinny, can we have another picture of our tight hamstring? Not this one, not this one. They are telling about the treatment part basically. Oh, not this. Okay, leave it, no problem. So whenever there, okay, just leave it. So whenever there is a tight hamstring muscle, so this hamstring tightness will cause more. Okay, back to slides. Will cause more pressure around the knee area. So that is why it is the first thing we do is to check the flexibility of the different muscles. So firstly, we'll check about the hamstring muscle, and then we'll check about the ankle. In the ankle, we'll check about the calf muscle, the Achilles tendon, and the calf muscle. So what we will do is we'll do the dorsiflexion of the ankle, and we'll check for the flexibility. If it is restricted or if it is less on the affected side, then definitely we need to treat the calf muscle in that particular area. And usually it is found that these are tight in the case of the patellar tendinitis. So these are usually tight in case of the patellar tendinitis, right? So we for making our treatment plan. Yeah, next slide, please. Yeah, so we for making our treatment plan. Okay, you can stop the slide here, and then we'll see for the treatment. So for the treatment plan. So now we have to make our treatment plan. For the treatment plan, we need to take on three things. Firstly, we'll check about the flexibility of the hamstring muscle, right? So firstly, we'll do the SLR, or we'll do the straight leg raising, and we check whether this muscle, this hamstring muscle is tight or not. So if it is tight, then it will go into slight flexion. Okay, if the hamstring muscle is tight, it will go into flexion. It will go into slight flexion. But if it is normal, then it will remain straight, right? And or do always compare the right and the left side. Always compare the right and the left side. That means the affected and the non-affected side. Okay? So we have to check thoroughly about the affected and the non-affected side. And once you do this, you will find that on the affected side there is tightness around the hamstring muscle. That means when you for the if the hamstring is tight, then you have to pull the leg to make the leg straight. Then you have to pull the leg or the ankle area up to make the ankle straight. Whereas on the other side, it looks like normal. That means even after you are putting the pressure, there is no further scope of straightening the leg. But in the muscle which is tight, there is always a scope of straightening the leg when we put on pressure at the ankle region. So that means there is some lag that is occur at the end range. So the end range would have some 15 to 20 degrees of flexion. So end range would have some 15 to 20 degrees of flexion around the knee area. So that means when we do this straight, so it could further be straightened. Whereas on the other side, it looks like just a straight knee, right? So we have to always compare on the affected and the non-affected side of the knee area, right? Yeah, translation please.
Oke, jadi sebelum kita melakukan treatment, pertama kita harus mengecek flexibility dari otot, terutama bagian hamstring dan kemudian bagian pergelangan kaki. Jadi mengecek pergelangan kaki ini bisa mengecek ketegangan pada otot calf. Jadi pengecekannya kita lakukan SRA, yaitu pasien posisi terlentang, kemudian kakinya lurus, satu kaki diangkat ke atas lurus. Apabila kakinya tidak bisa lurus atau membentuk seperti kayak lututnya ada bengkok atau sedikit fleksi, berarti ada ketegangan pada bagian hamstring. Nah, selalu ingat harus cek dua kaki, kiri dan kanan, satu yang bermasalah dan yang tidak. Jadi kita bisa membandingkan dua kaki tersebut.
Right. After this, we'll check around the calf muscle. We'll check about the flexibility of the calf muscles. So for the flexibility of the calf muscles, we have to flex, or you can say dorsiflex the ankle. So when we dorsiflex the ankle, we'll see that there is certain tightness. That means the range is restricted on the affected side. Like if on the affected side, if you do, then you will found that on the normal side it is always less. On the normal side, let us say if it is 45 degree, and then on the affected side it would be some you can say 10 to 15 degrees less movement. So that is why we need to check on both sides about the hamstring muscle as well as the calf muscle. The first thing is, in such cases, we need to check for the flexibility of muscle. For the flexibility of muscle, we need to check hamstring and the calf. So this is the way we need to check on both the muscles first, right? Yeah, translation please.
Kemudian kita melakukan pengecekan pada daerah otot calf. Jadi kita melakukan dorsifleksi pada bagian pergelangan kaki. Untuk kaki normal, kita ambil contoh, misalnya normal kita melakukan fleksi pada bagian pergelangan kaki itu bisa sampai 45 derajat. Tapi ketika kita melakukan pengecekan pada daerah yang bermasalah, itu dia hanya bisa dibengkokkan sekitar 15 derajat saja. Berarti ini menandakan adanya ketegangan pada daerah otot calf.
So after this, we'll check certain muscles, and also we can check about the back extensor muscles. Like we can ask the person to do the bending, like either in the sitting position, we can ask them to do the bending, try to touch the you can say touch the feet with your hands. So when they bend, they will have a restricted movement. So in that case, there would be tight extensor muscles, back extensor muscles tight. In the sitting position, we'll ask them try to touch your feet. So when they try to touch the feet, sometimes they are not even able to reach the feet. So that means they have the tight back extensor muscle. In that case, we need to treat the extensor muscles as well. Yeah. So these are the things which we need to check for the flexibility. These three things: hamstring, calf, and the back extensor. Translation.
Okay, kemudian yang
Muscle. And then we'll check about the certain muscles which are uh, weak. For that, we will check about the VMO, that is the vastus medialis muscle, right, on the inner side of the thigh, the VMO muscle on the inner side of the thigh, right. So for the VMO muscle, how we can check the VMO muscle? For checking the VMO muscle, we can do two things. So, like in this case, here it would be the VMO muscle. Firstly, just by the observation. If we observe the muscle, this area, if we observe the muscle, this area on both side of the leg, if we observe this muscle on both side of the leg around this area, we'll find that there is certain depression. There is certain depression, or you can say the bulk is not the same as it is on the normal side. So the bulk of the muscle will not be the same as it is on the affected side. On the normal side, it would be slightly higher. On the affected side, it would be certain wasting which you see, right? So wasting of the VMO muscle. Along with that, for checking this, the action of VMO is last 10 to 15 degrees of extension. Last 10 to 15 degrees of extension. So when we have to check for the VMO, we can ask them to, we can put the towel underneath the leg and we can ask them to straighten the leg. So once they straighten the leg, so we can put slight resistance and then we can compare it on the right and the left side. So then we can check about the strength of we can compare the strength of both the muscles, right? That means both the side of the muscles. Okay. So for that, what we will do is we'll put one towel, just a roll towel like this. We put the roll towel or some roller underneath the knee. We'll put a roller underneath the knee and ask them to do the extension, last 10 to 15 degrees of extension. Once they do the extension movement, last 10 to 15 degrees, and then we can put slight resistance under over the leg area, over the ankle area, and then we can compare it from the right and left side. Okay? Then we can compare it from the right and the left side. Then that's way we can check about the VMO muscle. That is the vastus medialis obliquus muscle. Its action is last 10 to 15 degrees of extension. Yes, it is extension, not the flexion. Flexion will do for the starting position, so that last 10 to 15 degrees extension the person can do. So the action of VMO is extension, last 10 to 15 degrees of extension. So we'll slightly flex the knee and then ask them to straight. Only then we will be able to check about the muscle power, right? So for now, we have seen about the VMO muscle, and also we need to check for the gluteal muscle. So for the gluteal muscle, we can lie them in the prone position, that is with the abdomen down, and then we can ask them to raise the leg. Okay. We can compare the strength by putting slight resistance around those areas, around this leg area, and we can check about the muscle power. So if we compare the right and left side, we'll find that on the affected side, the gluteals would be weak. right? So these are the things we need to look upon, and that we have to design our treatment according to the findings we get from this particular patient, right? Like when we find that there is tightness around the hamstring muscle, then we have to treat for the hamstring muscle first. So for treating the hamstring, if we take this as a lower limb, and this is the gluteal region. Yeah, translation please. For treating the hamstring, this is the lower limb, and this is the hip area, and this is the thigh area, and this is the knee area. The first treatment we'll do is we'll put two needles at the AP direction at the level of the knee, right? So we'll put two needles just underneath this joint, right? So when we flex, just underneath this joint, around this region. So we'll put two needles, and this will stimulate the area. This will remove the inflammation around that area, right? So exactly on the area of the patellar tendon, we'll put two needles and we'll stimulate it, and then we'll see about the pain response, right? This will, you can say, reduce the pain around that particular region. Now, what we will do is we'll treat on firstly the hamstring muscle. So as you know that now this is the thigh area. So for treating the hamstring muscle, we need to go oblique around this area. So for treating the hamstring, we'll go oblique, can put two needles and then do the stimulation around the mid portion. We can put two needles and we'll go for the stimulation, right? So after this, we will ask again person for checking the area around the knee. So let us say patient say even after this patient say that there is a very less pain or no pain, but still let us take a you can say stubborn patient. Like he say that there is only 30-40% relief after this, right? So then we take on few more muscles, or then we take on the next muscle which will improve the flexibility and ask relieve the stress around the patellar tendon. So our goal is to relieve the stress around the patellar tendon, right? So the overloading which occur because of the imbalance of the muscle. So these are the imbalances of the muscle, because hamstring muscle is tight, what is vastus medialis is weak, gluteals are weak, and the calves are tight. This will create an imbalance around the lower leg, right? So this will cause the pain. Okay, so this after this we'll take on for the calf muscles. So if this is the knee and this is the leg area and this is the dorsiflexor muscle, and the calf muscle will be on the underside. So for treating this, for reaching this, we'll again put two oblique needles around the calf muscles. So it will go oblique AP around the calf muscles. So that is around this area, right? It goes like this. So it goes like again oblique for the calf muscle area. So it goes oblique for the calf muscles, right? Now we have treated this for the muscles which are tight and also for the patellar tendon. Now we'll ask the person to see the response, or ask them to walk and check your pain. So let us say patient say the pain is okay, and but when he comes for the next sitting, the pain comes back. Right now we have to fix this the muscles which are weak. Yes, we need to put the needles on the head area. This is for brain stimulation we are doing. This is for the brain stimulation, right? Now, when the patient say there is still the pain, or pain has come back and it is not fully resolved, So for that conditions, we will take on few other muscles, that is the gluteal muscles around the hypothenar eminence. So we'll take on gluteal muscle. Yes, that also works. Hafiz, that also will work. If you put the needle on in the hand area, and but the only thing is that you need to stimulate it with the proper stimulation, right? There are certain stimulators which Shastri sir has designed and innovated. So you need to use certain stimulators because without using the stimulator you will not get the result. Only needling will not get the results. You need to use certain stimulator of this kind. So although these are not the Chinese one, these are designed by Shastri sir, and as you can see that this is the advanced brain stimulation. So there are five more in this line, so which we require, and we use this for the stimulation of the brain areas. So for the brain, we require the brain stimulation or the advanced brain stimulation. So these are must. Even if you are using it on the finger, then also it is must. Yeah, duration is basically initially like we are when we are stimulating. So it will give the stimulation for you can say 7 or to 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8. That's it. Then we'll ask the person to move that particular part like this. Now when we are doing it for the hamstring, so we'll ask the gluteal. Then we ask the person to do the gluteal exercise, right? So when he does the gluteal exercise, or when we check the gluteal muscles either in the prone or in the supine line, and then we if we check the strength, this will improve the strength. So once the strength is slightly improved, we'll give further stimulation. We'll give again further stimulation for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we'll again ask the person to move the limb. And when we check the power, we compare the power, it has gradually come up. It is almost normal. Since it is not a neurological problem, just in one or two stimulation, it will come to normal, right? And similar way, we can do it for all other muscles. If you are doing it for the tight muscles, sorry, and even if you are doing it for the tight muscles, like you are doing it for the hamstring, then you need to check the hamstring. When you check the hamstring, that would have relieved, or it has come to normal, it becomes straight. It will no longer be flexed, it will become straight. Or it has increased to 10 to 15 degrees, then you do further stimulation, and then you check that it will further increase to more 5-10 degrees, and until it becomes fully straight, you can do the stimulation around that area, right? So this is for the hamstring, sorry, the gluteal muscles we have just saw. And now we can add the further one muscle, that is the VMO muscle, that is the vastus medialis obliquus muscle. And the vastus medialis is present just on the inner side of the thigh area. So around this area, it is the vastus medialis muscle, and the center one is the rectus femoris. So if we see for the rectus femoris, it will be in the center. Almost the same. The rectus femoris is in the center, but if we go just adjacent to that, like in this yellow color, you will see this is the rectus femoris. So this is the center of the rectus femoris, right? But for the VMO, we have to go slightly medially. We have to go medially. But if we go laterally, then it would be vastus lateralis, right? So we have to go slightly medially. How we confirm that this is medially? It is close to the midline. So midline is the spine, and close to the midline, it is the vastus medialis muscle. So we'll put two needles for the vastus medialis, and then we'll go for the stimulation. Okay, two needles, vastus medialis, and then we'll go for the stimulation. Vastus medialis. Okay. So this, yes.
Can I ask one question?
Yes, yes.
If it is backside of the patella and wandering pain around the tibial region, what would be the cause and where to do stimulation?
Yeah, if it is just like the chondromalacia patella, you mean to say that?
Yep, yep.
Yeah,
Or
it
patella
is.
femoral.
Yeah, it is. If it is just like a chondromalacia patella, that means the undersurface of the patella. Then
Yes.
also see why this. We need to always see the why it occur. So if we see the why, we will find out that it is almost the same muscles which are affected.
Right.
Right? We need to check
Right.
about the flexibility of all these
Yeah.
hamstring, all these muscles, and weakness of all these muscles. So the conclusion is same.
Okay. Got it.
Yeah, yeah.
And
So we
why
need to
the wandering pain is
actually
coming?
by using the NIBS, we are balancing the muscle. And
Right.
proper only because of imbalance of the muscle. Right?
Uh,
Yes, it is the
and,
same treatment plan.
and why wandering pain? Like some people like it is around the patella. Sometimes it will be around tibia. It will be around. So they keep on misjudging it.
Yeah, that is because of the biomechanical things. So in that we need to measure the exact Q angle. So if
Yes,
biomechanical
yes, and
are disturbed, yeah, even see, that is what my next part is after this. So even after doing this treatment, sometimes the patients say that there is still pain relief is there, but it still come back.
yeah. That is the thing. Yeah, it comes
Yeah,
back.
it comes back. So we need to fix the root cause, right? So what
Right.
will do if the patient say even after doing this treatment, although the pain is less and they are comfortable and they can do their activities, but still there is some nagging pain which irritates or which keeps on coming back even after
Right.
you are doing the treatment. So in that case, we need to treat the muscles, all the muscles around the hip region.
Okay.
Okay. So in that case, we need to treat all the muscles around the hip region that we did in the last 2 3 days. So we need to fix all the hip muscles, right?
Right.
From the adductor, internal rotator, external rotator. So all the small muscles you have to treat. So once you treat all these small muscles, the obturator and the pectineus, gracialis and gemelli and all this, so it will fix the pain permanently because it corrects the Q angle. And also if there is any biomechanical problem underneath, that would also be corrected by balancing the muscles of the hip area. Would we use the right, what is the question?
No, the same thing. Right hand or left hand, we must use. The newcomer is asking
Okay.
whether he must use right or the left hand.
Okay.
The
Yeah,
same
the
side.
same
Same
side
side.
we need. Yeah. Even you get the results by opposite side also, but for our concept is of the synaptic plasticity. So we work on the synaptic plasticity. So that is why we use it on the same side. Although we know that the brain fibers, the motor fibers at the level of the cortex, it crosses. That means the right side of the brain controls the left side controls the right. But since if any problem, that is as you know that whole of the body is governed by the brain, and once there is any problem, like if there is any problem on the left side, definitely the right side neurons in the brain would also get some you can say affected, or connections are not proper. So by synaptic plasticity, what we'll do is we'll treat the normal side, like we that is why we treat on the left side. So this will create the synaptic plasticity on the affected side. So the brain will help in taking over of that particular side, and this will create in developing this synaptic plasticity, and this relieves the condition. This relieves the problem of that particular patient. Right?
Even supplementary cortex will play a role in that, no?
Yes, very much.
Yeah. So you treat both sides.
No, we can treat on the same side, sir.
No, you said you would say one side of the brain has an issue, so you treat the opposite side of that, the healthy side. Did you say?
Let us not confuse. In the NIBS, we have to treat on the same side. Okay.
Yeah, got the point. Got the point.
Yeah.
Sir, I have a question, sir.
Sir, someone asking, sir.
Mm-hmm.
Someone asking, for osteoarthritis, can we do the same treatment?
Yes, it may help definitely. We have to start from the hip joint, but the progression is different. In that case, you need to start from the hip joint. Okay.
Okay, thank you, sir.
Yeah. Muscles would be same. See, the you can say the logic, or you can say the mechanics, that must be understood, right? We need to play with the different mechanics of the different joints. So that need to be clearly understood. Only if we make it clearly understood, then we will be able to plan our treatment. That is why we always say planning the treatment is must. Before you do any treatment, just sit back, Google it, and just if you know the condition, even though, just read it and just make a plan of the treatment according to that, and then you will be able to see the many things, and you will be able to clarify many things, and you will be able to see the things that you are missing. Even sometimes we know the condition and we are treating it from last 10 to 15 years and even 20 years, more than that, but still we sometimes miss important structures, important things, right? So that is why planning is must. Before we go for any NIBS treatment, we should plan our treatment, and then we'll see what all things we are missing, and we can add upon, and then we even if you are not getting result in any particular patient, just make a new plan for that, right? Just to make a new plan, what all things you need to cut off from that, and what all things you need to add on add in that treatment. Then you will be able to do the more better neuroplasticity in the brain,
Okay, thank you, sir.
right? Yeah. So that was the treatment. So if we do not get result by this, then we need to treat all the hip muscles, the smaller muscles of the hip joint, and then we will be able to see the better and the fixed recovery for such patient, right? Yeah, now I can ask your questions regarding this patellar tendonitis. And we need to, anything's left in the slide, just get back to the slides. We'll see if anything's left in the slide.
I have a question, sir.
Yes, sir.
What about the patient complaining chronic pain inside the joint, knee joint,
Mm-hmm.
inside the knee joint,
Yes.
not around the knee joint, but
Mhm.
inside the knee joint.
Yes.
The solution is same. That
Yeah, that is more likely just like the chondromalacia patella, right? So yes,
Yes.
definitely you can treat it in the similar way. See, any pressure, any undue pressure, any undue overloading which is occurring at the knee joint could be treated in the similar way, right? Whether it is a chondromalacia patella, or it is a patellar tendonitis, or the iliotibial band pain, or there is some pain around the upper quadriceps region. So all these things would be treated in the similar way.
what about the arthritis, knee arthritis?
Arthritis will come, we'll take one full class on that. It's a long topic for discussion. Yeah, we'll take one full class.
Okay, thank you.
Okay.
Thank you, sir.
Dr. Rahul?
And just a second. And one thing, we need to check for the foot thing also, right? We have missed about the part for the foot area. So we have just done only for the that means the calf muscle, or you can say the tendon Achilles. And also we need to see about the arches of the foot and the foot area, right? So many a times it is because of the you can say arches that are damaged, So that are basically needs to be corrected. Like if the medial arch is collapsed or the lateral arch is medial arch is high or the lateral arch is collapsed, so that also will cause effect at the knee area, right? So we as we have already done for the arches of the foot, so that also you need to check and you can treat according to that. Or else if you do not go for the arches, just treat the muscles around the leg area, that is the peroneals and the dorsiflexor. So if we treat the dorsiflexor and the peroneal, that would be sufficient to relieve the pain around the knee area. Yeah, questions?
Dr. Ausa?
Yes.
Please, I want you to clear me with something because I'm confused.
Oh, just let us
Anatomical,
know, we'll clarify.
yes. In anatomical standing, you made us to know that the back of the hand is the middle finger is where we have the spine at the back. So it means that here at the back is the spine. Now you're talking of the gluteus muscle around here. Gluteus muscle here. Gluteus muscle. Gluteal muscle.
Just a second, I'm not able to see you.
Okay.
Winnie, can you highlight her?
See her? She's on the screen. She's on the screen.
Just a second.
Hello, sir.
Yes. Yeah, now tell. We are able to see you.
Thank you, sir.
Yeah.
Now, you say at the back of the finger here, at the middle finger, the back here is the spine.
Yes.
Now, you're saying that here now is the gluteal muscle. Gluteal.
Yes.
How about this? Because this is the back of the spine. I thought this knuckle is supposed to be the gluteal.
Okay, I got your question. I need to find a doll. Just a minute. I'll explain. Just give me a minute. I'll clear it. Yeah, it will work. Now, are you able to see this? Right?
Yeah.
So it is same like position on the area. This is the same position around this area, right?
Okay. Yeah.
Okay. So if we compare, so now gluteal, this area, the leg area is here, right? So
yes,
leg. So when we make the holographic from the hand,
yes,
right?
sir. Yes,
this
sir.
is the spine area. The center one is the spine area, right?
Yes.
So
yes.
This is the spine area.
Yes.
Clear?
Yes.
Now this in the holographic leg has this is the normal anatomical position, right? This is the back side, and this is the gluteal region, right? But when we make it into the holographic, the gluteal will come here now. It will go underneath this, and this holographic will be on around this side. So it will rest like this on the head.
Oh.
It will turn up around inside. So now the gluteal is underneath this.
Yeah, all right.
Yeah. So for reaching this area, we need to go oblique. Got it? And you can see this iliopsoas has come here, quadriceps has come here. So that is why we are going AP. Dorsiflexor AP.
Okay.
But so this side is the underneath.
It goes oblique.
This is underneath. So that is why it goes oblique.
Thank you, sir. Yeah.
it is.
Doctor,
Yes, ma'am.
please, I want to ask a question about it. It's a personal case. It has to do with the knee, but it's a bit confusing for me now. Now,
Yeah. What is the confusion?
the pain in the knee started because I was changing position from sitting on a bed and I was sliding to the ground. Now, when I got to the ground, my knee locked in an upside down V. I was, my foot was on the floor and my knee was up and my foot up on the floor. Now, the thing is, I could not straighten the knee back.
So, that is basically the condition of the popliteus muscle, right? So, if you see the action of popliteus muscle, so the action of popliteus muscle is to lock and unlock the knee, to unlock the knee basically, right? So when we, just a minute, I'll just clear it. So when you, when we are standing, right?
Okay.
So this knee is locked. Okay. And when we are sitting, this leg, this tibia goes into the internal rotation and the knee is unlocked and then it is flexed, right? So this locking and unlocking of the knee is done by the popliteus muscle that is present on the back side of the knee, around this area to this area, right? So in that case, you need to treat the popliteus. Then in that case, person will not be able to fully straighten the knee because the locking and unlocking is the problem. They will not be able to get up from the ground to the straight position, right? Because the locking and unlocking becomes affected, and this is done by the popliteus muscle. So in that case, you need to treat on the popliteus muscle.
Okay, because what happened was heat was applied and it's actually straightened back. But the problem is that after that, the calf cannot touch the thigh, as in I cannot sit down, kneel down and sit on my calf. It's very painful. The knee becomes painful. So, but the knee has been straightened with heat. But after that treatment, I still cannot touch the calf. Cannot touch the
because
thigh.
the root cause has not been treated.
Okay.
Maybe tomorrow we'll take on this. No problem.
Okay. Thank you.
Okay. Any more questions?
So, how did you check for the tightness of the calf muscle other than palpation? Again?
Other than palpation, you can ask the person to stand out on the toes. Simple.
Stand on the
toes.
Oh, okay.
Or you can ask them to do the squatting position.
So if they squat, that means the calf muscle is okay.
Yes. We can. The good thing is to ask them to do the either do the squatting or sit on the ground. Ask them to sit on the ground, right? So when they sit on the ground, the side which is affected, they will not be able to fully touch the ankle on the ground. That means the heel part is not touched. It will remain slightly up on the affected side.
On the affected side. Okay.
Yeah.
Okay, thank you.
Right. So in that way, we will be checking, apart from the palpation, that this calf muscle is tight. Because of the tightness of calf muscle, the heel is not touching the ground. Okay. Is this clear?
Yeah, thank you.
Okay. Yes, ma'am.
Okay, I show this picture. You can see on the screen, right?
Yeah.
Okay, so just now the treatment that you show us is for the
patellar tendon
problem, which is at the bottom, of the patella, right? So how about the inflammation starts here? That means your pain is here.
Same.
So you use the same treatment.
Because see, why this area got affected is because of the excessive loading around the knee region. The chondromalacia patella, patellar tendon, quadriceps tendon, all these are in the overload. They are in the overstress. They have the stress around this area. So why this stress occur? It is because of the imbalance of the muscles. So once we balance around all these muscles, this will relieve the pressure around this area, and this will relieve the whatever stress or whatever tightness or whatever you can see structures that are getting into the friction. That would be relieved, and patient will be pain free. Okay.
So that means that just now the treatment you show, it can be applied for pain around this whole area, including this muscle and this muscle.
Yes. It is basically extensor tendon, extensor mechanism. Just write down on Google extensor mechanism. Extensor mechanism, or extensor mechanism of knee. Mechanism of knee. Yeah, just wait up. Just one side. No, we want side view.
Side view?
With the tendon and all. Yeah, left side. Yeah, left. Yeah, this one. This one is okay, right. So here you can see. Yeah, this is okay. So here you can see this is the extensor mechanism. That means it acts as a pulley, right? The quadriceps muscle is coming all the way from the hip. Just make the picture clear, Vinny. The right side picture.
Yeah.
The right. Yeah.
Okay.
Yes. This is okay. So here you can see about the extensor mechanism. This is actually the whole mechanism in which these patella act as a pulley, right? The quadriceps muscle is crossing the three joints, that is coming from the pelvis to the hip and then to the knee, and it is ultimately inserted into the tibia, right? So all these three joints it is crossing for, and on the upper side you can see the quadriceps muscle. Then we have the quadriceps tendon which is attached to the patella, and patella is further attached to the patellar tendon, right? So this is the mechanism. This act as a one system. All these things: the quadriceps muscle, quadriceps tendon, patella, and patellar tendon. So all these structures act as a one mechanism. So that means they all helps in the extension of the knee, right? So any problem around this area, this portion of the quadriceps muscle, or the quadriceps tendon, or the patella, or the patellar tendon. So this is a one mechanism. So any problem in this mechanism, you can treat it with the treatment we have discussed it today. Because this is because of the stress around the extensor mechanism. Okay.
Okay. Thank you.
Okay. Hope it is clear now. Yes.
May I ask, is this the reason why the patient feel pain in the knee inside?
This is the reason why patient feel pain in the
knee inside.
Inside. Yeah, the chondromalacia patella developed because of this one. This is because of the extensor mechanism got disturbed. And for correcting the extensor mechanism, we have to do the same treatment, but we have discussed it today.
Can I ask a further question? Is that in the MRI? The MRI is something.
Anything what it say, anything it would say, whether MRI, X-ray, ultrasound, anything it would say. If it is an extensor mechanism problem, we do the same NIBS treatment, you will get the result.
So
right?
So is the in the physical examination is better than the MRI.
Yeah, definitely. We do not require these things.
Thank you, doctor.
Yeah, thank you.
Sir? Yes.
Hello.
I have a question, sir.
Yes. One by one, please. Yes, your question.
Surgery
Doctor,
for
may I have
meniscus also it is can be treated.
yes, ma'am.
Meniscus
Meniscus, it has a different treatment.
that cannot be corrected in this.
No, that has totally a different treatment.
Okay, this is the typical part.
Yeah, we'll take one class of that.
Okay, sir. Thank
When
you.
we do osteoarthritis, we'll cover that.
Okay, sir.
So, Rahul, I have a question. Should we treat the same thing, the same treatment for this arthritis with?
No,
What's the
arthritis is
difference? What's the difference with arthritis with patellar tendonitis?
No, in that the extensor
approach is
mechanism
different,
is
right?
not disturbed. In that, in the osteoarthritis, the extensor tendon is not disturbed. That there might be possibility that it may affect, but it is more of the you can say muscular imbalances that are occur at the various different levels. Okay. So when we study osteoarthritis, we'll see what all things we need to see in that and how we can treat it with using the NIPS, right?
Yeah.
It is the different treatment for the osteoarthritis for the knee. Totally different.
For the patellar tendonitis, what is the mild symptom?
Symptoms, these are the inflammatory signs, basically the tenderness, pain, swelling, redness. All these inflammatory signs will be present around that particular tendon.
Okay, so how many times we can treat this patient?
It depends on the pain of the patient. According to that, you may ask them to come. Like initially, you treat every alternate day if it is acute, and once the pain has subsided or it has reduced to 60-70%, then you can call them once a week, and you can also advise them certain exercises that we have given in the slides. Certain stretches, certain exercises that they can do at home during that time, but always take a long follow-up with the patients, right? Like 1 week, after that you can call them after 15 days. Like if they say that if the pain has come in between or they have done some sort of exercise that have aggravated the pain, so then you can call them in between also. But if they are going well, then you can call them after 1 month for the follow-up, whether they are going okay, they are going well, and gradually you taper off the treatment. Never, you can say, because pain we can recover easily, but for treating the condition, the swelling inside, it will not go until whole of the pressure would got relieved, like the whole of the extensor would not get corrected, right? So that will take time, and neuroplasticity will take time, right? So although we can recover the pain in 3-4 sitting, or you can say if it is a very chronic, then few more sittings, but to recover them completely, that it will not reoccur again, we need to take up long follow-ups. Always take long follow-ups up with them. Every 15 days or once a month, minimum for 3-4 times they have to come. And once we are assured that during this span of time they do not get any pain, then we can ask them to do their normal activities or the sports activities.
Actually, we must correction the gait pattern also, right?
Yes.
Because when the patient have a patellar tendonitis problem, they have a bad habit to stand, or it's a compensatory gait.
Yes. All these things we need to look upon, whether they are using any faulty postures or faulty way of walking, that we can tell them. And even we can do the gait training with the using the NIBS also. If they are not able to correct themselves, then we have the way, we do it from here.
NIBS. Should we give the knee braces also for
Yes, we can advise such patient the open patellar hinge knee brace. Open patellar hinge knee brace.
patellar.
Hinge knee brace.
Hinge knee brace.
H-I-N-G-E, hinge knee brace. Yeah. Anybody can please write down in the chat. Open patellar hinge knee brace. Right? With the aluminium support. With the aluminium support.
Aluminium. For how long? For 8 hours a day? Because I have a patient
yes,
like
they
that.
can put it from throughout the day, like when they have to walk and do the activity. And but they still have to wear it for the long time, so that once it would get completely relieved, then you can taper off. Yeah.
Okay, thank you so much for your advice.
Okay. Thank you.
I will tell you for the future after I treat this patient.
Yes, sure.
Yeah, okay, thank you, sir.
Thank you. Any more questions?
Sir?
Yes, ma'am.
Sir, we'll insert the needles in the below patella or above patella, sir?
I didn't get, ma'am.
For this, we'll insert the needles, no, sir. First you told that above patella or below patella, sir. We insert the needles here.
Yes, that is for basically the local joint treatment.
Yes, sir.
Local area treatment. So this will be below the below.
Below, okay.
For patellar tendonitis, it is below patella.
Okay, sir. Thank you, sir.
Yeah. Towards the leg side.
Yes.
Any more questions? Okay, then shall we close it for today?
Okay, sir.
All right.
Thank you, Doctor.
Good night, everyone. Thank you.